Hi there, this is Chip Mosley with Total Motion Physical Therapy. First of all, thank you so much for taking the time out of your busy schedule to come look at our webpage to find out more about what is this money back guarantee stuff. I know I'm really busy myself. In addition to running a clinic, I got 5 children, I got my wife needs me for a lot of things, I'm a coach of sport, all that, and I know you're busy too. So first of all, just know the fact that you would take the time, whether you're a doctor or a healthcare practitioner, or maybe you're a patient or who was referred to this page by a friend or family member or something like that, just know the fact that you're that type of person who would take time out of your busy schedule to watch this. Just know you're the person that I was designing this program around. This is really why we did it. Because if you think about running a physical therapy clinic, well, how do therapists and owners typically go about trying to get people into their clinic? Well, for one thing, we often go to doctors' offices, and we tend to, there's that little bit of that push. There's that, we walk in, we know you're busy, we're busy, and so forth. And you may not, the doctors may not want us in their office. We don't really necessarily want to be in that office in all cases because we know you're busy, and we don't want to step in time and step on shoes and so forth with that. So there is that bit of a push and pull. Maybe sometimes doctors like us bringing them food or something like that. But really, at the end of the day, that's not who really we are. That's not where our joy is. And doctors' offices having us come to there is not necessarily where their joy is either. So really, if I'm a physician office, I need to know that if I'm going to take a patient of mine that has a pain in a muscle or a joint, if I'm going to send them somewhere for treatment, I want to feel pretty confident and comfortable with the ability to do that. Now, part of what some things we struggle with as clinicians and so forth is just like every doctor I meet always feels that they're so uniquely different from the next doctor and the next doctor, and maybe and probably they are, and so forth, and just not all of them are the same, and not all of you are the same. In the same way, not all physical therapists are the same. It's kind of like vanilla ice cream. Sometimes when you talk to a doctor's office, they'll say, well, since every physical therapy is the same, I'm just going to send you wherever your #1 place is. And when we interviewed doctors not too long ago, we found out that was their #1 reason why they sent anywhere. It wasn't based on results, it wasn't based on style or treatment or different type of things. It was just, well, if they're all the same, then I'll just send you to the place that's geographically closest to you, and we'll make sure your insurance company is covered by that. But again, that's not who we are. That's not what we do. And if you meet several other physical therapy clinics around here, you'll find there's a huge difference between what one does from the next and so forth. And there might be a different style difference and a completely difference in results. So us knowing that, what we have chosen to do up until this period of time is to say, I'm going to go bang on a bunch of doors, walk into the office and say, here's our statistics. Here's how we compare nationally to other places. And we have great statistics, and we've always been proud to kind of run through the door and do that stuff. Or maybe we'll tell you about our program, how it's unique. The owner of the company and myself, we designed a tool, the only tool in all of healthcare, where we teach not only clinicians how to assess and find and fix any muscle and joint pain using this process that we developed called Total Motion Release, but we also teach every single patient who comes into our office the same process. So that they can learn how to fix themselves, and you can learn how to fix yourself if you come in my office, in addition to obviously feeling better. And we found by teaching people, they actually get better faster and deeper, and that lasts longer than if we were just trying to do traditional therapy while I was just trying to do the fixing. So we've got that. Sometimes doctors, we think, they would be interested in knowing about, are you a trainer of the other clinicians in this world? Well, yes. Well, with this tool that we've developed, we've now trained a little over 4,000 clinicians nationally and internationally on what we do and how we do it, and been very successful doing that. Or sometimes doctors' offices are kind of impressed with other little interesting facts, like the Dallas Cowboys flew out our owner of our company to have them treat some of their players this last year. Or we've treated some other key professionals and politicians, for example, in this area. That is all cool, but we've been doing that for quite some time in terms of going to doctors. And at the end of the day, there's still this feel like, if I'm a doctor, how do I really know that you're really that different from this place and this place? So again, there's a sense of, well, if they're all vanilla ice cream, then I'll just go on things like location. Then there's the other aspect. We also interviewed docs saying, well, what do you think about physical therapy if someone has a muscle and joint pain? What's your routine of treatment? And almost every one of them came out and said, well, Chip, I believe so much more in things like physical therapy than I do in medications. And then I said, all right, so I asked this doctor recently, I said, all right, if that's true, about how many patients would you say you saw last week? And they said something around 100. And I said, okay, of those 100, about how many of them had a muscle and joint pain problem that might benefit from something like therapy? They said, well, maybe half. And I said, okay, of those half, how many of them got a prescription for some medication or drug? And they said, well, every single one. I said, okay, of all those same people, how many of them got a prescription of physical therapy? They said maybe one or two. So maybe stop and think. I said, well, why? Why is that? You just told me that you believe a lot more in physical therapy than you do in medications, yet every single one got a drug, and almost a very few to almost none got a prescription of physical therapy. And maybe stop and think about if I examine my own life. If I was a physician and I had my patients, we often tend to flock to what feels safe and easy for us. So for example, there's a sense that a lot of patients like medications. It's easy for me to write it, they can go get it filled, hopefully that takes care of it, piece of cake. It's not always necessarily that easy to ask someone to go spend a handful of weeks going to therapy a few times a week, where you're going to have to exert energy as well as co-pays and time and so forth to try to work some of this stuff out, even if you believe that's really what they need. So how could we make that easier? How can we make it easier on a doctor's office? How can we make it easier on a patient to say, you know, I may really want to do this, but I'm kind of scared to put that time and energy and money into this if there's a sense if I'm not really sure if it's going to work. Or maybe I don't know that that clinic's different from that clinic. Or maybe I might want to try a different type of treatment other than physical therapy. How can I feel pretty confident in doing that? And that's where we said, all right, one of the gifts we figured out we can give is what if we had a money-back guarantee? Which essentially comes down to this. We have a few different forms of that we talk about with patients in the clinic. But basically, if you go through your typical prescription of therapy, which for us the average patient stays kind of close to about 5 weeks, which is nice because that's actually less than the national average. But if you go through your typical prescription of therapy and you give your effort as we would expect on your homework and things like that in here, and you show up for all your appointments and so forth, if you're not at least 50% better at the conclusion of your time in therapy, then you get some money back. And well, if that's the case, you know, then that takes a lot of the fear out of going, because either A, I'm going to get better, or B, if I can't be helped by physical therapy, I'll at least know that in my heart that it didn't work, and at the same time of that, I can get some money back in that process as well. So that can be pretty cool. Yeah, so that takes a lot of the risk out there. So really we have here, and it talks about on this webpage below, a certain time period. We're running this campaign right now where we're offering to doctors' offices and to some patients as well this period of time where you can have this prescriptions for a money-back guarantee. Now in doctor's offices, if you would like me to send you something, fill that out, or if you're a patient, fill that out on the lines below. And as soon as you give me that, your email and who you are, address and things like that, I will get those out there as quick as we possibly can to you. And that's all good. But be aware again, this is only for a limited amount of time. Now, who is it that we don't want really involved in this? Well, if you're a doctor's office, for example, and you kind of treat patients like, yeah, I'm going to go to work, I clock in my 8 to 5, I do my kind of minimal effort that I can so I can get out of here and go home. Yeah, that's really not necessarily who we want. Now, I'm not saying don't go spend time with your family, because I'm all about that. My faith and my family are the most important things to me. What I'm saying is, if you're the type of person that says, I'm always looking for that next thing that makes my life easier in terms of time and energy and everything else, but I'm wanting to see is there that next thing that might do that. Well, I want you to feel this. You're the kind of person we're looking for. So I want to get you those scripts so you can try these things out. So again, thank you for this time. We appreciate that. When this video is done, go ahead and go down to the things below where you can look at a few more videos to find out more information about us if you like. Certainly great. We've got a lot of things on that page. But other than that, we just want to say get that information out. We'll get it back to you as quick as we can. And God bless. I look forward to working with you.